In this mini lecture, we'll discuss the relationship between development, globalization, and health. The recent COVID 19 pandemic has illustrated, in a global context, how interconnected we all are related to issues of health and medicine. However, prior to the pandemic, many scholars argued that all regions of the world were going through a transition from diseases that were predominantly infectious or parasitic to diseases that were more chronic or degenerative in nature. However, not all regions of the world were going through this transition at the same time, which meant that many developing nations faced the double burden of dealing with both communicative or those infectious diseases and non communicative diseases such as cardiovascular disease. In addition, scholars have recently illustrated the ways in which our environment has impacted our health with a number of studies that are related to global pollution and its impact on health among people both in the developed world and in developing nations. We've also seen that research has illustrated that health outcomes and health care are gendered issues. And therefore, as we go through the material today, you'll see the ways in which the various health concerns that we are exploring and experiencing today impact men and women sometimes very differently. Lack of safe access to sanitation facilities is a major problem in the developing world, especially for women and girls. The Millennium Development Goals, which were 8 international development goals that UN member states agreed to try to achieve by the year 2015, aim to improve the availability of access to sanitation by half. However, the challenge was greater than expected. Progress was made. Globally, coverage increased from 49% in 1990 to 63% by 2012. However, access to sanitation varies by regions, with some countries in Africa and South Asia having less than 40% of the population with access to improved sanitation. And in 2017, 775,000 people are estimated to have died prematurely as the result of poor sanitation. It's been estimated that approximately 30,000 people die each day in developing countries from infectious diseases, partly because world trade rules on drug patents restrict poor people's access to essential medicines. This availability is now improving, and by 2015, generic medicines were available in over half the public health facilities and in two-thirds of private sector health centers in low and middle income countries. This is important because the research has shown that increases in access to generic medications greatly decreases morbidity and mortality rates. As a reminder, morbidity rates speak to the rates of disease or illness, while mortality rates are death rates. We know that there has been a big increase in treatment access for major diseases such as HIV, malaria, and tuberculosis in developing nations through both national and international funding. However, the need for medicine is gendered, as women's experiences of illness differs from that of men, and women generally have to care for other sick members of their family, which in some cases can put them at risk of illness. We also know that there's an excess of deaths of girls and women aged under 60 relative to men and boys in developing countries, according to the World Bank. Poverty and health are closely related, but economic improvement does not necessarily lead to better public health, as we saw earlier this semester in the reading by Block on medical tourism. The increased cost of health care has immediate effects on attendance at clinics, but it may also impact social and family decisions. For poor women, this can be especially taxing, as they often have low social status, few decision making rights, and heavy workload. For men, the loss of status through unemployment may lead to the adoption of life threatening behaviors, such as alcoholism, taking drugs, or even suicide. We cannot talk about globalization, development, and health without speaking about food security and nutrition. Food security is the state of having reliable access to a sufficient quantity of affordable, nutritious food. It's been estimated that between 2012 and 2014, at least 805 million people experienced extreme chronic malnourishment. And therefore, in 2016, the UN General Assembly proclaimed the years of 2016 to 2025 to be the UN Decade of Action on Nutrition as a means of addressing the various forms of malnutrition that exist in a global context. We also know that there's a strong correlation between gender inequality and food and nutrition insecurity amongst malnourished people, as it's been estimated that approximately 60% of malnourished people are women and girls. We know that poor rural households may spend as much as 90% of their income on food, and yet many still have an inadequate diet. Women's lower status relative to men and their biological role in reproduction often puts them at a higher risk than men for nutritional problems. Therefore, scholars have argued that tackling food security needs to be a gender just global vision of a world without hunger, where all people, regardless of biological sex or gender, have equal access to nutritious foods and the means to produce, sell, and purchase food. Finally, it's worth noting that seasonal fluctuations in food supplies also impact food security and access to nutrition food, especially in rural areas. At the time for planting crops, there's an increased demand for labor, but food supplies from the previous season could be depleted, and because of that and other factors, put folks at higher risk to disease and illness. Before wrapping up today's mini lecture, I want to speak a little bit about health and life stage. Research has shown that in both developed and developing nations, that health impacts individuals at different points throughout the life course. In infancy and early childhood, as this is a time of importance for physical development milestones, low birth weight has been associated with higher infant mortality and poor health outcomes, and this is often seen among developing nations. In childhood, persistent inverse associations between socioeconomic status and childhood mortality have been found. In other words, among the poorest areas of the world, there's an increase in childhood mortality rates. Globally, we know childhood deaths and infant mortality rates are decreasing, but it's still been estimated that approximately 18% of children in developing nations are malnourished. It's also important to note that among developed nations, research has found that there's a relationship between junk food consumption and socioeconomic class. In adolescence, much of the research on health and life stages focuses on the increase in risky behaviors, or on the ways in which mental health issues emerge during this period. In a global context, research has looked at early marriage and the impact of pregnancy, as well as the long-term negative health effects pregnancy in young adolescent women can result in. People are living longer than ever before, And it's estimated that 100 million older people in developing countries live on less than $1 a day. In 2010, the world had about 16 people aged 65 and older for every working aged adult. But the United Nations estimate is that by 2035, there will be 26 elderly people for every working aged adult. Over the same period, we also expect that old age dependency will double, and we expect that more women than men will be living longer. In 2020, 1 in 5 women in developing countries is over the age of 50, and the projected 250% increase in this age group has major implications for women's health and well-being, not just for elderly women, but also for their caretakers, who are predominantly also women. As long ago as 1982, the United Nations had a World Assembly on Aging, and in 1987, the UN International Institute on Aging was set up and has been conducting research ever since. The Institute has found that in developing nations, there's a repeated complaint of lack of infrastructure and trained personnel for the rapidly growing number of older people.